Dear friends, welcome to my Geriatric Medicine channel. I am Dr. C.J.K. Shomurthy, geriatrician in Shumaga. Now, I will discuss about a few common diseases which will affect the senior citizens. The prevalence of diseases in urban and rural elderly people varies. Hypertension, diabetes, and heart attack, arthritis, obesity, and depression are common in urban elderly, whereas in rural areas, nutritional deficiency it is quite common. They are very poor and they are ignorant about the food to be taken. The skin and chest infections. They are exposed to all the changes in the atmosphere, especially the rural people, the agriculture, and so infections are there. Because of chronic or the continuous exposure to sunlight, they possess the cataracts, and arthritis is very common because they have to work very hard in standing position, walking position, etc. So these are the few common diseases with which they suffer. So now let us know a few aspects about hypertension. First of all, is it a disease or is it a changing aging process? That is doubtful, because hypertension is not a simple physiological accompaniment of aging. It is not everybody doesn't suffer with aging. Hypertension as age advances. Many patients about 80 years, 90 years, some younger elderly about 70 years, they doesn't suffer with diabetes or hypertension frequently. Only a few persons will suffer from that one. This is clearly shown by the population study in Western society, where BP tends to be normal. The BP doesn't tend to be normal, it is abnormal. Non-Western society, where BP tends to be normal, are even low in aged population. When these people migrate to Western society for some reason to join their children in America or England, Western Germany, Europe, etc., hypertension tends to develop in their community because of the food changes and uh, environmental changes. So, development of hypertension depends more on environmental factors than lifestyle rather than simple aging. Simple aging is not an accompaniment of blood pressure. So, okay, we measure for maybe BP when patient comes to us with some physiology, some disease, and we come across and we diagnose hypertension. So, what level of BP needs treatment in elderly people? In youngsters, we 120, 80 or something, 130, 40, 90, etc. We come across all those readings and we say it is normal. Hypertension. Hypertension is usually defined as systolic blood pressure of more than 140 millimeters, regardless of age. And diastolic blood pressure of more than 90 millimeters of mercury is also abnormal. So 140 by 90 is considered as a normal blood pressure for elderly people. BP above these levels needs treatment. A reduction of blood pressure is very important. Any risk factor for the development of high blood pressure are there. There are several risk factors. Risk factors are there for developing high blood pressure. These include family history, stress, smoking, then overweight, obesity, what we call, and alcoholism, high sodium intake. Some people eat a lot of sodium in the common as common salt in their food, and low potassium and calcium intake also tends to develop blood pressure in elderly persons. These are major consequences of hypertension if it is not treated. What are they? These I told you, but what are they? Heart, heart attack and heart failure, brain, stroke and dementia. Stroke, it is called paralysis, and dementia is forgetfulness, and some other serious complications of dementia also in there. In blood vessels, arteries and veins, reduced blood circulation to limbs takes place in elderly people. Kidney, kidney failure may take place. Eyesight, failure of vision may happen, and giddiness may develop in elderly person with hypertension. Now, it is possible to reduce the blood pressure without drugs also, non-pharmacological treatment. It's possible. It mild to moderate hypertension. Non-drug therapy may be tried. Reduce excessive weight. Non-stop smoking. Non-smoking is very important. Stop smoking at least from today. It is very important. So far you have smoked a lot. A lot of nicotine has accumulated in your blood pressure, in your body, and damaged your arteries. At least stop smoking from today. Restrict salt intake. 4 to 5 grams of salt is more than sufficient per day, but we Indians, we take at least double of that one. Regular physical exercise is a must. If we can do some exercise, it is okay. If we cannot do, at least half an hour, 30 minutes of walking per day is very important for senior citizens. If it is not possible because of arthritis of the knee, etc., the patient should sit on the chair and exercise the upper half of the body and the lower limbs. Though they are unable to walk for quite a distance for half an hour, this must be done regularly, at least for 30 minutes a day. Then, to control stress, meditation is very important. Avoid stress, stress factor. For that, meditation is very important. Is it true that blood pressure needs lifelong treatment? Not always. No, not always. Because of this treatment with non-pharmacological methods without drugs, if it get reduced, you don't have to take the drugs at all. All hypertension patients continue treatment after the BP is controlled. Naturally, they believe on doctors Doctors say you should be taken regularly, every day, every 2 times a day, 3 times a day. Of course, in the first or second or fourth visit, the doctor will advise accordingly. But later, and so the patient also continue taking blood pressure tablets without further consulting the doctor after say over 2 months, 3 months, etc. It is said that if you stop the drug, BP will start increasing. If you discontinue it, you should not discontinue it. That's the advice given. Stepping down therapy, reducing the drug to the optimum dosage, can be tried slowly if and optimum blood pressure should be achieved. If BP decreases, therapy must be stepped up again. If the BP becomes, say, about 70, 80 by 70, although elderly people cannot tolerate such a low blood pressure, and so therapy must be stepped up, increase in the drug, and the dosage should be considered. Dear friends, this is about, in nutshell, about blood pressure in elderly people. Here onwards, I will try to put these things in English for sometimes say about 40 to 50 episodes from today about various aspects of uh, diseases of the elderly people. So, friends, thank you very much for kind hearing of this speech. Please subscribe to this region uh, episode. Share it with your friends. Thank you very much. Jai Bharat, Jai Karnataka. Thank you.